I'd now like to introduce you to Dr. Paul Kavanagh. Paul is a trained medical practitioner and working as a specialist in public health medicine for a long number of years now in the Health Intelligence Unit in the HSE. And Paul has worked with us in the Tobacco Free Ireland programme for 5 years, I'd say now, Paul, and he's provides wonderful clinical leadership to us in the programme, and is a stalwart advocate for the tobacco control agenda. So Paul is going to take us through the State of Tobacco Control report in Ireland, which describes what we're doing currently and what we need to mobilise in order to deliver a tobacco-free Ireland. So thank you very much, Paul, and you're very welcome to the stage.
Good morning, everybody. So here today to talk to you about an epidemic. And epidemic's very much on our mind, given the experience that we've all lived through over the last 2 years. We've learned to live through an epidemic, and we've learned to control an epidemic as well. And you know, we've gotten to grips with things like understanding a susceptible host, what's the agent involved here, the importance of the environment. And then we've learned the key components of controlling an epidemic. You have to have your leadership and governance in place. Intelligence is critically important. And then we learn to implement non-pharmacological or policy interventions, and we use medicines as well to control the epidemic. At the same time, as we've been dealing with the COVID epidemic over the last 2 years, really for the last 50 years, we've also been dealing with an epidemic of tobacco-related harm in Ireland. And we're still deep in the harm that smoking causes to our population in Ireland. Each week, there's over 80 deaths in Ireland from tobacco-related disease, enough people to more than fill a Dublin bus. Each day across our health services, there are over 500 to 600 patients in hospital beds because of smoking-related disease. And just to put a picture on that, that's sufficient to fill a hospital the size of Limerick or St. Vincent's. So we're still deep in the harm that tobacco is causing the population here in Ireland. As I said, intelligence, using information, that's really key to planning your way through an epidemic. And in terms of the tobacco epidemic, the WHO recognises this, and annually it publishes a report on the global tobacco epidemic. So one of the measures that we put in place within the HSE Tobacco Free Ireland programme a number of years ago was to produce a series of state of tobacco control reports to understand all of the data in terms of where we are in relation to trends around smoking across our population, to review our service activity, and to inform the next steps that we set out through our programme plan. So I'm here to speak to you today about our second State of Tobacco Control report, and I'd like to start to acknowledge the work done by my colleague Aisling Sheridan, the Research and Information Manager with the programme, who worked with me on this piece. So to begin with, where are we in terms of smoking prevalence? So currently in Ireland, 18% of the population smoke. And over the period 2015 to 2021, we saw a 0.6% annual reduction in smoking prevalence. So good progress, and some concern that in terms of the most recent Healthy Ireland Survey 2021, we may be seeing some stalling in trends, but good progress overall, but still some way to go, a 72% reduction required in smoking prevalence if we're to hit our goal of less than 5% prevalence in the population by 2025, which is our Tobacco Free Ireland goal. So progress, but some way to go in terms of delivering this 2025 goal of a tobacco-free Ireland. So that's the overall picture in terms of where we are at the moment in terms of smoking prevalence within our population. We need to go deeper, though, and understand how the epidemic is evolving across our population. So let's go a little bit deeper and take a look. So this picture here shows you the trend in smoking prevalence by gender for men and women across the period 2015 to 2021. So positive to note that there has been a decline in smoking prevalence for both men and women, and an equal decline across the period, a 4% reduction for each of them. In each year, smoking prevalence higher among men than among women. There are very similar challenges faced by men and women in terms of the tobacco epidemic, but men and women have distinct needs as well that we need to respond to. And insofar as we do have gender-responsive health action plans within our health system in Ireland for women and for men, I think there is a margin for us to bring more focus to smoking within those action plans, bearing in mind that 1 in 8 deaths among women and 1 in 6 deaths among men are smoking related. When we look at the problem by age group, we see an interesting pattern. This is illustrated on the slide here. So in particular, positive to note, as Philip mentioned, we've seen good reductions in smoking prevalence, both absolute and relative, in the younger age groups, those aged 15 to 34. Some reduction as well in older age groups, but to a lesser extent. And what we're starting to see here is the dividends of the investments that we've made in preventing smoking initiation among younger people. And this is evidenced by data here presented from the Health Behaviour School Children Survey conducted by our colleagues in Galway. So we've seen good declines in smoking across children and young people across the different age cohorts. So that's positive. However, at the same time, we can't rest on success. And we're very conscious of the findings signalled by Luke and colleagues at the Tobacco Free Research Institute through their work on the SBAD survey, which showed that after a period of historic decline in smoking prevalence among our teenagers in the 15 to 17-year age group in the period 2015 to 2019, we saw a small increase in smoking prevalence. So really, you know, the issue in terms of smoking and trying to prevent smoking initiation in young people, that problem is still smouldering, and we really do need to keep a close eye on that issue because that's key in terms of our potential to reach a tobacco-free Ireland. Next, then, when we look at the problem across socio-economic groups, the reason we do this is that there is a wide gap in health expectancy across our population. So the CSO tells us that people who live in our most deprived areas can expect to live 4.5 to 5 years less than people who live in our more affluent areas in Ireland. So that's a very, very stark statistic. And I think it's often something that's hiding in plain sight when we talk about challenges that face the population when it comes to health in Ireland. So a very wide variation in health expectancy across population groups when we look at it through the lens of social class. And obviously, recognising that that is a very complex problem, multiple different factors involved, and we need to take a very wide system approach and work on this over a long period of time. However, within that problem, we have to recognise that international evidence tells us that up to 50% of the gap in health expectancy between our richest and poorest groups relate to differences in smoking behaviour. So really, any work that we're going to do in terms of tackling health inequalities must begin with a focus on smoking behaviour. So we've looked at the trends in smoking prevalence across social groups in Ireland, and this is illustrated on the slide here. So at the top we can see the smoking prevalence across the period 2015 to 2021 in routine and manual occupations. And then at the bottom of the slide in orange, we can see smoking prevalence across the period 2015 to 2021 in higher managerial, administrative and professional groups. And what you can see is across the period, while those in more affluent social groups enjoyed the benefit of reducing smoking prevalence between 2015 and 2021, that same benefit wasn't enjoyed among people in lower socioeconomic groups where the prevalence has remained stalled. And across that period, at the start of the period in 2015, there was a twofold difference in smoking between the richest and poorest groups in Ireland. And across the period then to 2021, that gap has widened to a threefold increase. So from our perspective in the programme, in terms of our theme for today, that for us has to really be a key focus in terms of all of the discussion that we have with you and all of our work in terms of tackling smoking moving forward to make sure that we leave nobody behind. Looking then at the different types of smoking behaviour and the different products that people use. So you can see here on the slide the breakdown in terms of current smokers between those people that smoke daily and those people that smoke occasionally or less than daily. So positive to note that across the period, there does appear to have been a small reduction in the proportion of people who currently smoke who reported they smoke less than daily, those people who report occasional smoking, and that reduction particularly evident among younger people who tell us that they smoke. However, I think overall that trend probably is not stable enough for us to discern if that's going to become an established trend and something that we need to focus on moving forward. What is more clear, though, is the trend that has emerged in terms of roll your own product use. So within the HSE, particularly through the work done by the Environmental Health Service on the tracker survey, we have called attention to the emerging issue around roll your own product use in terms of the challenge around smoking. So we have seen over the last 10 years that the population prevalence of roll your own product use is around 5%. And then, against a backdrop of declining smoking prevalence, the share of current smoking behaviour, which relates to roll your own product use, has actually increased across the period and is continuing to increase. So this really means that we need to focus on that differential that there is in terms of affordability of roll your own product use and combustible regular products as well, to make sure that we are not, as we're working on reducing smoking prevalence rather than moving people towards quitting, actually diverting them to using different types of products. And that increase in terms of the share of current smokers that are using roll your own products, that's been a particularly marked feature among females and among younger smokers across the period that we studied. Looking then at the other emerging product use, which is e-cigarette product use, while across the period 2015 to 2021 there was initially an increase in the prevalence of e-cigarette use, that does appear laterally to have stabilised, but I think we will need to see more years' data before we can gain more confidence in terms of the stability of that trend. And we know that use of e-cigarette products is more common among younger people, and younger people have seen a significant step up in terms of that product use, and the use of e-cigarettes is more common among former smokers as well. And in terms of that point around e-cigarette product use being more common among younger people, and that's data that we collect through our Healthy Ireland survey, which relates to people that are 15 years and older. When we look at this through the SPAD study, and I'm showing here some data from our colleagues Luke and co at the Tobacco Free Research Institute, they have drawn attention to the increasing prevalence of e-cigarette use among teenagers in Ireland across the period 2015 to 2019. So this is very much something that we need to keep a focus on. We have a significant gap in terms of protection of young people because we've not passed legislation in Ireland to prohibit the retail of e-cigarette products to younger people. Very much welcome the fact that legislation is currently under scrutiny, has been prepared and is under scrutiny to address that gap, but that's really something in terms of our next step around e-cigarettes within the tobacco control agenda that we need to make sure we move on. Looking then at a positive intention to quit. Positive intention to quit across smokers remains high in Ireland. So each year over 6 out of 10 people who smoke tell us that they're positively interested in quitting. We have seen a small decline in that across the period 2015 to 2021. I think we're bearing in mind that our reading of that laterally has been through the period of COVID, where I think all of our lives have been impacted in different ways. So I think it is, as Philip said, very important for us to focus on the positive, which is that the majority of people who currently smoke are interested in quitting. There has, however, been a decline in positive intention to quit among younger adults and people in middle-aged year groups, among people in lower socio-economic groups, and among people who tell us that they smoke daily compared to people who smoke occasionally. And then in terms of what people tell us about the quit attempts that they're making, again, very positive to note that each year 1 in 2 people who smoke tell us that they've made at least one quit attempt in the previous 12 months, and that remains high, although there has been a small decline across the period 2015 to 2021. But again, we're bearing in mind some of the issues that relate to COVID over the last number of years. Looking at reported quit attempts across population groups, we have seen a decline in reported quit attempts among people in middle-aged and older age groups, among people in lower socioeconomic groups, and among people who smoke daily compared to people who smoke occasionally. So oftentimes when countries like Ireland are moving forward in managing the tobacco epidemic, this question emerges as to whether we're seeing what's called hardening of smoking, or whether smokers, as smoking prevalence declined, those people who continue to smoke are perhaps less interested in quitting than those people that we managed to work with maybe 5 or 10 years ago. But I think it's very important for us to focus on the fact that when we look internationally, and this is data from the European Commission's Eurobarometer survey that was published last year, and when we look across EU 27 and UK countries and we ask people who smoke about their quitting behaviour, actually Ireland stands out as a leading country in terms of the level of interest that there is among people who currently smoke in making quit attempts. So I think that's a great platform for us to work on, and really a testament to the culture change that has been affected through the sort of policy work done by our Department of Health, and then also through the work that we do in the Tobacco Free Ireland programme, and noting in particular the good work that our colleagues in communications do around our mass media campaigns. So still our people who smoke in Ireland are interested in quitting. So bringing all this together, we are moving into the late phases of the tobacco epidemic in Ireland, which is positive. Men have probably moved there earlier than women, but certainly we're seeing progress for both men and women. Now, this model of the tobacco epidemic, it has 4 stages, and as I said, positive to note that in Ireland we are moving into the final stages of the tobacco epidemic. But there's nothing about that model to suggest that necessarily, because we are in the final stages, that this epidemic will come to an end. You know, that bringing the epidemic to an end is going to require additional effort. So I'm going to move on now to speak about the sort of work that we're doing within the Tobacco Free Ireland programme, and work that we're doing across the health system in terms of tobacco control. So all the work that we currently do is modelled around the MPOWER model from the WHO. These are tried, tested, evidence-based measures that work in terms of controlling the harm caused by tobacco to the population. So within the HSE Tobacco Free Ireland programme, as Martina said out at the start, we are responsible for taking forward some of these actions, and then other actions are the responsibility of wider partners, including our colleagues at the Department of Health. So focusing in first on the work that we do within the Tobacco Free Ireland programme. So need to begin with really the critically foundational work of building and ensuring compliance with public health legislation that's led out by our Environmental Health Service within the HSE. So within that work, one of the key developments over recent years has been activity around market surveillance provided for under the Tobacco Products Directive, which is an EU directive that governs tobacco products within Ireland. So as you can see here, in terms of the level of notifications received by our environmental health services, between 50 and 60,000 notifications of products in recent years. This is a very resource-intensive area of business for our environmental health services. And through that market surveillance then, they are both responding to and issuing notifications across European member states in relation to concerns around tobacco products. In particular, those concerns tend to relate to e-cigarettes, and people will be aware that very recently there have been concerns in terms of the nicotine content around in a particular e-cigarette product within our Irish market here that was identified by our environmental health services, and then that led to activation of this RAPAC's European network in terms of sharing that information with other member states. So that market surveillance work really foundational and critical. And that's new, but then our environmental health services are continuing their work in terms of inspections and test purchases. So you can see the scale of this work set out in terms of inspections at the top and then test purchases at the bottom. And just noting, of course, that work, because it's face-to-face and because our environmental health services have been leaned in on with the rest of us in the health services responding to COVID in the last couple of years, that activity has been impacted by that in recent years. But this slide here just speaks to the sheer scale of that activity and the important role that it plays in terms of ensuring that we have safe environments where tobacco legislation is being effectively implemented. I think, though, at the same time, we need to note that, notwithstanding the good work of our environmental health services, approximately 1 in 5 inspections are unsatisfactory, and again somewhere between 18 and 13% of test purchases that are done with minors are also unsatisfactory. So this really points to the importance of forthcoming legislation in terms of licensing of the retail environment, which is going to provide our environmental health services with a modern regulatory toolkit to make sure that the really critical work that they do in terms of building and ensuring compliance with tobacco legislation, that work is enabled through robust, fit-for-purpose regulatory system. Moving on then to our work in communications. So over the course of the last 4 years since we spoke to you, we retired our I Will Survive campaign, and we introduced a new a Last Stop campaign to warn the public about the harms caused by smoking and to signpost them to our services. And again, that work, I think we've had great track record of success in terms of our mass media campaign. They're all in our mind. We can think about the 1 and 2 campaign. We can think about the Jerry campaign. They've been picked up internationally as well. So I think it becomes harder and harder, doesn't it, for us to keep those campaigns fresh. But I really need to acknowledge the good work that's done in our communications department in terms of ensuring freshness around those campaigns. And you can see here at the top the benefit when we switch from retiring our I Will Survive campaign to launching our new Last Stop campaign. We can see the impact that has in terms of a step up in activity that we measure around quit plans through our website. And then you can see at the bottom then, when we have those periods during the year where we bring a particular focus on our mass media campaign. So we now have a stop month in October, and we have a campaign around the Last Stop. And you can see there the step up that there is in terms of our demand for our stop smoking services. So this work around mass communication, it really does work. It's becoming more difficult because the social media environment is changing, and I need to acknowledge the work that our communications do in terms of responding to that. Very agile, very much ahead of the curve in terms of positioning and tactics to make sure that we're getting the most from social media. And just calling out here then, particular work that we did with communications over the last number of years to build a new online social media-based Quit program. The Quit Club, initially delivered through a closed Facebook group, now delivered through a new platform. And that, from our perspective, has been essential in terms of the interruption that we had to our face-to-face services over the last number of years with COVID. So innovation continues in terms of communication and using mass media. Stop smoking care. It's not an understatement to say that stop smoking care is life-saving. 1 in 2 people who smoke will die from smoking. So unfortunately, though, as you can see from this slide here, too many people who pass through our health services don't benefit from a conversation with a healthcare professional around their smoking behaviour. They're not advised to stop smoking. They're not signposted to support. So that, from our perspective within the programme, is going to be a big focus over our forthcoming programme plan. As we mentioned already earlier this year, with the National Clinical Effectiveness Committee at the Department of Health, we launched Ireland's first National Stop Smoking Guidelines, which for the first time set out clearly what is safe, effective and clinically sound stop smoking care for the public and for healthcare professionals, and a big focus for us now in terms of embedding that and ensuring that people experience that consistently on a day-to-day basis when they use our services. A big investment, as you're aware, in our stop smoking services. So we now have an additional 50 stop smoking roles across the country, an additional 3 million each year being invested in stop smoking services. And that's being focused in different areas. It's being focused in Sláinte Care Healthy Community Programme areas. So that's us starting to respond to that widening gap in terms of the social inequalities in smoking. So we're focusing this in on Sláinte Care Healthy Community Programme areas. And within that, we're delivering a particular model of stop smoking care, which involves the communities themselves, called We Can Quit. And I need to acknowledge the good work that colleagues in primary health and public care, public health in Trinity did in terms of testing that model for us. And I need to acknowledge as well the leadership through funding provided by the Irish Cancer Society to road test that model. So we're now taking that model forward. Those services as well will be delivered as part of enhanced community care, delivered in our maternity services. And I think a focus for us now required in terms of making sure that we don't leave people in our mental health services behind as well, and really welcome the session that we have this morning and the work that you'll hear from our colleague Margaret O'Grady in terms of trying to bring these services to that group as well. We've also put in place a new information system, Quit Manager, and that will be really important moving forward as we increase our investment in stop smoking services to ensure that those services are quality assured and improved on an ongoing basis. And this data here demonstrates the continuing effectiveness of those services. You can see over the COVID years there has been a small decline in terms of service activity to be expected, but through the investment and through the work of the people that are in the room today, very much look forward to bringing those services forward in the future. Within the health services, we do a lot of work in terms of making sure that our health services are a smoke-free environment. And as people know in the room, that's much more than telling people to put out cigarettes and putting up signage. That's really around making sure that the whole organisation is delivered in a way that makes sure that when people smoke, that they benefit from good stop smoking care. I need to acknowledge the work from a previous colleague of ours, Miriam Gunning, in terms of this innovation around a new bursary scheme, which I think from our perspective has really reignited that agenda around tobacco-free campuses across the health services and has been a great success. We also work with wider partners around smoke-free environments. Delighted to have colleagues from the Irish Prison Service here today. I need to acknowledge their leadership in terms of taking the bold steps to try and work on a smoke-free environment within the prison services. They did a pilot with us in Mountjoy where they not only delivered stop smoking care, but they supported that by trying to effect a smoke-free environment for prisoners and for staff within Mountjoy. And that was very successful, not just in helping people to stop smoking, but also for people within that environment who don't smoke. We demonstrated that those people benefited in terms of a reduction in exposure to secondhand smoke, and they experienced health benefits from that as well. So I look forward to working with them in terms of taking that work forward and acknowledging as well work that's done around the country through partnerships between the health services and our local authorities in terms of voluntary smoke-free environments. So calling out here the good work in Limerick in terms of the Not Around Us campaign, and that campaign was noted by the WHO on World No Tobacco Day in terms of the exemplary leadership in building smoke-free environments and the collaboration between the health services and local authorities. So as I said, while our work in tobacco control is guided by the Empire model, everybody in the room knows that good tobacco control isn't about one thing. It's about a comprehensive, multi-component program where all of those components are mutually reinforcing, and then we are applying those components progressively over time. So the work that we do within the Tobacco Free Ireland programme is very much enabled and supported by work that's done by our wider partners, including the policy leadership and the leadership on legislation to our departments our colleagues at the Department of Health. And within our report, we put a spotlight on evidence that demonstrates what we know, which is that public health legislation works in tobacco control. So since our last report, we've seen the implementation of plain packaging, and that has been a long road to bring us to that point. And delighted to demonstrate with our colleagues in the department that that legislation worked. It had the intended impact in terms of more people reporting to us that packs were less appealing, and more people reporting to us as a consequence of plain packaging that they noticed graphic health warnings. So that will have an impact in terms of preventing initiation of smoking and reducing smoking prevalence over time. So public health legislation to tackle smoking works. And very much welcome the fact that the next piece of tobacco control legislation, the Tobacco and Nicotine Inhaling Products Bill, is currently under scrutiny with our Oireachtas committee. There are a number of components within that. It modernises and strengthens the regulatory system that our environmental health services work with to ensure that we're protected, particularly in the retail environment from tobacco products, and it would also protect young people in terms of putting in place a legal prohibition on retail of e-cigarettes to young people. So really important measures, and very much welcome the fact that that process has started and look forward to seeing that come to fruition. Taxation, again, I think when we think about tobacco control, we're always thinking about the great next step that we can take, and indeed we're going to talk about that today, and there are many great next steps that we can and should take. But the old reliables, tobacco tax, certainly there is room for improvement in Ireland in terms of our application of tobacco taxation and the impact that it can have, not just at an overall population level in terms of smoking, but along with stop smoking care. Tobacco taxation is one of two measures that is identified as having a pro-equity impact, and it is progressive. It has the greatest impact on those groups within our population that bear the greatest burden from smoking-related harm. So it was disappointing, notwithstanding the fact that 3 recent reports have noted the great work that we do in Ireland around tobacco control, but each of those reports did point out to the fact that there is more work for us to do in terms of applying taxation policy. And really the questions are we getting the most in terms of ensuring that we're affecting real price increases each year? Are we doing the most in terms of ensuring through minimum price, which has been recently introduced in Ireland, that we're countering the industry, cushioning the consumer from the impact of taxation-related price increases through shielding them in terms of not increasing the product price? And are we ensuring that our discourse around tobacco taxation policy is being sufficiently protected from so-called scare tactics? So it is disappointing to note in the papers, government papers around tobacco taxation, that there's such a heavy emphasis on illicit trade, on smoking, on reduction in revenue, on equity. These are well-renowned scare tactics that hold governments back from applying taxation measures to full effect. And really, I think there's an opportunity for us to look at recent technical guidance from the WHO on taxation policy and ensuring that we're getting the most benefit from this as a measure. So just in terms of wrapping things up, I think the question for us today, the question that we're looking forward to discussing with you really is, absolutely, we need to double down on the things that we know work and that we demonstrate work in terms of tobacco control in Ireland. Absolutely, we need to double down on those measures. But the question is, will those measures in and of themselves be enough both to reduce smoking prevalence to minimal levels to get to our endgame goal, and also to ensure that we leave nobody behind and that those measures benefit everybody in our population? So that's a question that we put to the public through an Endgame survey that we'll be launching this afternoon. We thought it would be very important to involve the public and hear their views in terms of the formulation of our new Tobacco Free Ireland plan. Very pleased to say that support from the public for a Tobacco Free Ireland is very high. Public see that goal as being achievable, and they have a very realistic view in terms of the achievability of that. They don't think that's going to happen next year or the year after, but they do think it's achievable in the next 10 years. We presented them with a range of so-called tobacco endgame tactics, which by their very nature, these tactics are bold, ambitious, and very much at the edge of what we might think is possible in terms of tobacco measures. And actually, there was huge support among the general public, including smokers, in relation to a range of those measures which you'll hear about this afternoon. And one of the key messages that we heard from the public was that absolutely they want to see us phase out tobacco in the population, but they want us to make sure that the steps that we take ensure that people who currently smoke are not left behind. So I think that's something that we need to listen to. So just in terms of wrapping up, we heard from the Taoiseach at the start of today that we have come a long way, and I think it's very important for us to note and acknowledge and learn from the success that we've delivered in terms of tackling smoking in the population and the reduction in smoking prevalence across our population. We have come a long way, and that's been through political leadership, work of the health services, work of non-governmental organisations. I know we're joined by a number of those today. But most of all, that work has been through the engagement and support of the public that's changed attitudes and norms that no longer sustain smoking in the population to the levels that it did before. And we asked the public, do they think that just controlling the harm caused by tobacco in our population is enough, or do we need to end it completely? And the public have spoken. They want a tobacco-free Ireland, and they want us to move there in a way that ensures that we leave nobody behind. And we're here today with you to talk about the next steps that we can take. So I think from our perspective, it's time to get to work. And it's time to ensure that we deliver Tobacco-Free Ireland, that we get the impossible done, and we do that in a way which leaves nobody behind. And very much look forward, on behalf of Tobacco-Free Ireland, to taking those steps with you and to getting the seemingly impossible done together. So look forward to our discussions today.
Thank you very much, Paul. My goodness, an awful lot to digest there, and you will have an opportunity this afternoon to talk through some of those in our breakout and groups. So thank you.